Hi, I want to tell you a little bit about why I'm here talking about diabetes. I'm a chiropractor, which most people associate with treating back pain and neck pain, and I do that. But I also do nutritional counseling, natural therapies for different disorders, and I made that kind of focus. I mean, in chiropractic school we have a lot of nutrition, basic nutrition, but I chose after graduating to really study that and pursue it. And I want to just kind of tell you a little bit of the story as to why I did that. I graduated, my bachelor degree was in industrial management, and I went into the oil field, and that's what brought me to Texas in the Houston area. And I achieved some success there. At the age of 32, I was president of an oil field service company, and things were rocking along. And soon after I achieved that level, my wife at the time developed breast cancer. And that just really upset my world and our world. And I was totally ignorant about most things medical. I didn't even know what an oncologist was. So I was starting from scratch in trying to help her deal with that. And she dealt with breast cancer and fought it for 7 years, and she lost her battle. In that process of being with her, I was really drawn to health and wellness and paying attention to it like I never had before. And I decided to quit the oil field, and I started chiropractic school at the age of 40. And while I was in chiropractic school, my father died from diabetes. And as I was already a student so much of cancer because of my wife's situation, I started paying attention to these issues that was dear to my family. And I learned that my father's father died of diabetes. My father had one brother. He later died of diabetes. I have diabetes very strong in my family. As a result, I paid very close attention to any time that diabetes came up. One of the things that I learned was that diabetes is not a disease. It's a disorder. A disease is like cancer or an infection, as if there's something in your body that's not supposed to be there. But diabetes means it's a disorder of the way that your body is functioning. Your body is designed to function naturally, but for some reason it's being pushed into the unnatural state of functioning. And that's what I want to talk about and explain that to you today. Just to kind of highlight some of the impact of diabetes, and please forgive me if any of you have suffered from these, but I've seen a lot of patients that just don't, they'll be diagnosed with diabetes, but they really don't know what that means as far as impact and, in their whole life. Half of America, 8 years from now, by 2020, half of America, 1 out of 2 people, will have diabetes or insulin resistance. And I'll explain what insulin resistance is if you're not familiar with that. 90% of those won't even know it. And this condition, diabetes and insulin resistance, is the leading cause of preventable death in America. The leading cause of preventable death. The CDC, Center for Disease Control, they did a study around 1992, and they said something that was just so shocking. It gave me chills when I first read this. That generation of children born in 1992 who are 10 years old today will be the first generation in the history of mankind that will live sicker and die younger than their parents. So just think about that. Since the days of the caveman, The children have always learned, the parents have always learned from their mistakes and their wisdom and passed it on to their children. And they have, the life expectancy has gotten longer and longer. But now, what we have our children today is going to be shorter than their parents. And it's because of insulin resistance and diabetes. So not only is this such an impact on our nation today, in the future, it's really going to shorten the livelihood, and they'll be sicker, before they die. People with insulin resistance or diabetes have 4 times the death from heart disease, 4 times the death from stroke, 4 times dementia, 4 times Alzheimer's. And there's even some studies that are starting to make Alzheimer's really look like a glucose dysfunction of the brain. And some scientists are starting to call Alzheimer's diabetes 3 as opposed to diabetes 2. That's regular diabetes that we know. 75% of those will have high blood pressure, 30 to 50% will have depression, 60 to 70% will have nerve damage. This can cause poor digestion. One of the things that I see, and I want to say often, it's probably not often, but it just seems more often than it should, is peripheral neuropathy. Foot pain in people who haven't been diagnosed as diabetic, but they're in the insulin resistance category. But yet they're suffering, they're already feeling the pain of diabetic neuropathy. Carpal tunnel syndrome, sexual dysfunction. It's a leading cause of blindness, a leading cause of kidney failure. It contributes to rapid and premature aging. It's a leading cause of amputation. It's increasing the risk of cancer. And it's estimated that a person with insulin resistance or diabetes will die 6 to 8 years earlier than they would if they didn't have that disorder. So the natural approach to addressing this issue is to control insulin and not focus so much on the blood glucose. So another way of saying that is the traditional way to address this issue is to focus on blood glucose and not worry about insulin. And let me just go over a little bit as to how glucose and insulin work. There's 3 types of foods are broken into 3 categories. You have fats, proteins, and carbohydrates. Fats is your storage medium that stores energy. Protein is the amino acids that are used to restore the tissue in your body, to make neurotransmitters. It's kind of the building blocks. Carbohydrates are what you use for fuel. And carbohydrates, the way it's used for fuel is the body digests carbohydrates and then converts it to glucose. And the glucose is dumped into the blood where it's circulated through your body. Every cell in your body needs glucose as a fuel, including your brain. But your body your cells that need that glucose can't pull the glucose out of the blood. Your arteries carrying the glucose are just like rivers running through your body. They're just carrying that glucose throughout your body. Insulin, you can think of it this way, insulin attaches to the glucose in the blood and pulls it out and takes it into the cell. Without insulin, the glucose will just float around in the blood. Okay? When you eat carbohydrates and it converts it to glucose, then the glucose, this is a curve showing the glucose in your blood. You eat here, and then the glucose level in your blood goes up. Soon after that, your pancreas, sorry, we got to go to a different color, starts secreting insulin, to bring the glucose down and put it in the cells. So then the glucose comes back down, and then the insulin follows. That make sense? So your insulin is always responding to the level of glucose in your blood. If you eat something that converts to glucose quickly, like sugar or a simple carbohydrate, then your glucose increase is going to look more sharp. It's going to go up like this. And then your insulin is going to have to go up high. And you can think of it kind of like a momentum. The higher the insulin goes, then when it comes down, sometimes it drops below the normal level. This is called hypoglycemia, when your insulin is too low and it's pulled out so much glucose out of your blood that you get hungry and sometimes jittery, a headache, irritable. Insulin resistance is when your cells over time become resistant to the amount of insulin it takes for the glucose. If in a normal person, if you eat a carbohydrate and your glucose goes right here, then your pancreas secretes this much insulin to carry it out. Insulin resistance means that your body is getting insensitive, resistant to insulin. So it takes more insulin to carry the same amount of glucose into your cells. And as you go on, it can take more and more insulin to carry that glucose into the cells. Insulin resistance, in every type 2 diabetic, that person has been insulin resistant probably all their life. So this is a continuum in that they don't handle carbohydrates, normally, and that spikes their glucose up and it spikes their insulin. Insulin has to go higher and higher. Insulin resistance for that category, so every person that's a type 2 diabetic, let's just say a person was diagnosed with diabetes, type 2 diabetes when they were 50 years old. Well, I see patients that are in this category, and this is what they tell me. I went to my doctor, and I'm not diabetic, but I'm pre-diabetic. And so, he just said, we'll check it in 6 months. Well, pre-diabetes is insulin resistant. And I liken that whole situation to a house fire, in that traditional medicine is well trained. They're the best trained people in the world to fight this fire if the flames are coming out of a roof. But a long time before the flames were coming out of the roof, there was smoke coming out of the windows. So this person that was diagnosed at 50, the flames started coming out of the roof. But for all those, or let's just say 40 years maybe, or 30 years, they were insulin resistant. And smoke was coming out of the windows. But nobody was looking for it, and nobody did anything about it. So that stage of insulin resistance, as far as officially with insurance companies today, and I'm sure you've run into this, as a doctor, if you come in as a patient and I'm going to bill the insurance company for treating you, I have to give a diagnosis that's appropriate for your condition. And there's a book of specific diagnosis. I have to use what's in there, and there is a definition of each diagnosis of what it is. Well, there's no definition in there for insulin resistance. So there's no national screening recommendations for insulin resistance. There's no treatment guidelines. There's no FDA-approved medicines. And there's no reimbursement to doctors. So the bottom line is doctors are not trained, expected, or paid to diagnose and treat the single biggest chronic disease in America. We do have guidelines and medications to treat full-blown diabetics. These are interventions in the body. They intervene with the process going on. And they're not correcting the cause. One of my sources in a book that I'd highly recommend to you is by Dr. Mark Hyman. You might have seen him on Channel 8. He's been on there, and he's been on a lot of TV shows. But it's called The Blood Sugar Solution. The type of approach of looking for the cause of a disease as opposed to just treating the symptom is a popular and gaining approach, and it's called functional medicine. In looking at how the body is functioning, not just treating your symptoms. And chiropractors in philosophy is kind of a holistic approach, and we can't prescribe pharmaceutical drugs anyway, so we're always looking for natural solutions. And we usually try to look for the cause of the problem and address that, knowing that the symptoms will be resolved if we can do that. I am a member of the Institute of Functional Medicine, which is kind of revolutionizing the way that our healthcare is used today. And Dr. Hyman is the president of that organization. 11 years ago, I went to their school out in Gig Harbor, Washington, and it was a special class. And at that time, probably 80% of the students that were there, the people that went, were chiropractors, and 20% were MDs. And today, it's the opposite. And there's maybe 90% MDs and 10% chiropractors. And I'm really glad to see that, because the MDs are the ones that are treating, issues like we're talking about today. But a lot of these folks, like Dr. Hyman, is board certified ER doctor and family practitioner,